Hi, I'm Richard Carter. I'm from Bloomington, Minnesota. I've been a patient at Mayo Clinic in Rochester for about 6 years now, and in that period of time, it's been nothing but a pure pleasure. So I originally came to Mayo Clinic about 6 years ago, and it was because I was misdiagnosed by another medical facility, and I wasn't sure how it was handled down here, so I made a call, and I was seen within 24 hours in the surgery department. Funny thing was, they were able to, where I was told I needed surgery, I found out at Mayo I didn't need surgery. Correction of diet, a few other practices, and we were well on our way. In that 6 years, I've had a very thorough medical history, and it's nice having all my records here at one time. I've had a hernia surgery here at St. Mary's that was just remarkable. I couldn't believe how well the treatment went. You have the attention of any of the staff, whoever you're speaking with at that given moment. There is an ethic, and at first, I think all medical facilities have ethics, but this one really does get lived out, and that's that the patient comes first. And you can notice it as soon as you walk up to an appointment desk. They look at you, they say, "How can I help you?" and they stay right on you. It's just absolutely refreshing and, to me, remarkable. I'll give you one idea. I was walking through the subway one day, but down by the cafeteria, and there was a woman in front of me, and she was putting on what looked like a medical alert bracelet, and she was futzing with it. She couldn't get it clasped, and all of a sudden it fell to the ground, and I was going to bend over and help her pick it up, but coming from the other direction were three male employees, two of whom were in suits, and their tag said MD on it. And one of those MDs, they all bent down to help her, and it was a doctor who picked up her bracelet and returned it to her. I think that's extraordinary. I think it exemplifies exactly the attitude and what sets Mayo apart from other places. One thing they want to make sure is, and they do it very well, is they want to know that, in fact, is the patient being taken care of. I don't see one doctor when I come here. Whatever I'm having dealt with, my primary doctor will see me, and then I'm always seen by a number of other doctors. And it only makes sense to me because of the simple fact that one doctor can't know everything about the human body. It's just impossible to do. When I came in, and I had been treated for 14 months by one medical facility for a leg problem. And I gave them more than ample opportunity, but my leg kept getting worse and worse and worse, and I was seeing one doctor, and then they gave me two insertion, and then the treatments weren't working. And eventually I fell down. My leg just gave out on me. And I came to Mayo Clinic, and I was seen in the orthopedics department, and brought all my records, and the rheumatologist I saw took the time, 15, 20 minutes, just to review all the records. He was looking at all the images. And his response was that, "Mr. Carter, with all due respect," he says, "obviously you're not getting the relief you need. I just think something's missing here. I don't think they're quite treating the problem." And with that, he asked if he could run a couple other tests that day if I had time. And of course, certainly I did. They were 2 ultrasounds. And what we found was that I had 2 blood clots in my leg, which could have been fatal over that 14 months. And within 4 hours of being here, they had me on blood thinners. I came in on crutches. Within 1 week, I was back to walking. Within 3 weeks, I was back to walking a mile in the morning with my wife, which used to be our old practice. And now, a few months later, I'm walking my normal 3 to 7 miles a day. Now, if I don't crack into tears on this one, it'll be abnormal. But one day I was supposed to get an MRI, and I was scheduled for 6:45 in the morning on a Friday morning. And it was at St. Mary's Hospital. And I came in early because I'm always early, and I was sitting, and the technician came in, and she said, "Just be a few minutes. I just have to warm up the machines, get everything calibrated." And I said, "Not a problem." I had a book, and I was ready to go. And this couple came in and sat down. They were obviously a rural couple, just by their attire and his corn emblem on his baseball cap, and she had on this very sunny summer dress, and they were sitting there. And if you've never been to Mayo, I will guarantee you always walk out with a library of paper because you see so many people. And in doing that, they were going through their stack of paper. And I could hear the comment that, this is a Friday, they said, "Well, we're going to see this person, and then we have this appointment, we have this one. Looks like we have to come back on Monday." and they seemed a little down about that. So it kind of went quiet, and being the chatty Cathy that I am, I said, geez, where are you from? He said, well, we're from Southern Illinois. We have a farm there. I says, I don't want to be nosy, but it sounds like you got to come back on Monday. She says, yeah, it's a little bit of a drive, but we got to go home. We got to take care of the cattle. So, I said, well, that's too bad. So I just kind of segued out of the room and went over to the technician. I said, these people are from way out of town, and they got to come back Monday for one appointment. Do you think you might be able to help them out? She said yes, and she went over and sat down with them. And she introduced herself and went through the paperwork and said, I understand you got a scheduling issue. And they said yes. She said, went through the paperwork, and she said, give me a minute, let me see what I can do. And she came back about 10 minutes later and said, you know, I can move this appointment here, and I checked, and they can move this appointment. And this blood work, I can get this done right down the hallway for you right now. Would you be willing to do that? And if we can do that, we can take Monday's appointment and move it up to Friday, up to today. Would that be okay with you? And they said, sure. And I sat and I thought, where else in a medical facility are you going to find that kind of care? Mayo has offered me and my wife the care that we've always hoped for. In the past, I've been really aggravated by being treated by other facilities as a number. Going to the counter in a medical clinic and having somebody more important to talk to their fellow employees or somebody in the back room than to talk to the patients at the front counter. And then when they do address you, you seem like something close to the potted plant sitting next to the wall. That just doesn't happen here, and it's something that for me, as I tell everybody, it's coming from the Twin Cities down here, it's worth every inch of the drive down for me. I just think it's a remarkable place. To me, there's no other on the face of the earth. It's just something else.